The Centers for Disease Control and Prevention and the American Academy of Pediatrics has and continues to recommend 3 vaccines for adolescents, but there are many who are not heeding this advice. A recent study has found that many of these adolescents are getting 2 or less of the vaccinations. Here to help us understand why medical professionals are recommending this and what parents should be doing is Dr. Felipe Zanghellini, pediatrician with the Lovelace Medical Group. Doctor, thanks for joining us this morning.
Good morning. Thank you.
So the CDC released a study, this was back in July, about 3 very important vaccines. First off, what are these 3 vaccines that are must-haves for teens?
The vaccines that we usually give to adolescents starting at age 11 are Tdap, meningococcal, and the HPV vaccine.
Okay. So let's break these down. Each of them. I know the Tdap. I've heard that before, and of course HPV, which we're going to talk about. But break down what each of these vaccines do.
The vaccine protects you. I mean, the Tdap stands for the T for tetanus, the D for diphtheria, and the P for pertussis or whooping cough.
Whooping cough, okay.
The meningococcal vaccine protects you against infectious by a very serious bacteria called meningococcus, and that causes meningitis and blood infections.
Okay, meningitis.
And the HPV stands for human papillomaviruses and protects you all the diseases and cancers caused by human papillomavirus.
Right, so that's another thing, which we'll talk about here in a second, that HPV has been linked to certain cancers. We'll also talk that men, it's not just for females, but you also recommend it for males as well, right?
We have been doing it in females for almost 7 years, and in males for January will be 4 years.
Okay. So now the Tdap, you can get that, I believe, at Walgreens. Even walk-in clinics, most of the times you can get this vaccination. Is that the same with the other vaccinations? Can you do it as sort of like an outpatient thing? Do you have to make an appointment with a doctor, or can you just get it at a pharmacy?
You can get it through your doctor, through your pediatrician, or your family practice doctor. You can get it through a nurse visit, or you can get it in places like Walgreens too.
Okay.
The advantage of getting with your pediatrician, with your doctor, you get the information that you can ask about the side effects, the information, and really what are you protecting your child, your adolescent.
Right. So now I'm curious as to why we recommend this so strongly for adolescents. Why adolescents? Are they more prone to getting these, or are you just trying to head these off at the pass before, as we get older, we become more vulnerable to them?
Well, for the Tdap, you get the primary series from 6 weeks to 4 years.
Okay.
And then you need a booster in order to keep a good level of immunity. That is for tetanus, diphtheria, and whooping cough. The meningococcals, there are 2 peaks of infection, one in children less than 1 year of age, and the other one in adolescents. So that's why we recommend them to get it before they go to college or they go into the military, because there is a higher risk of those populations in having the infection. And the HPV, the recommendation right now is to give it between the age of 9 and 26, ideally before they start having sexual activity.
Okay, before they start having sexual activities. And just to sort of drive home why these are so important, what are some of the side effects? If someone comes down with one of these diseases, one of these infections, what can potentially happen?
Well, in a typical year in the U.S., 4 people die from tetanus. 150 people die from meningococcus, none from diphtheria, and 20 from whooping cough.
Wow.
You know, HPV causes around 4,000 deaths every year.
Really?
So people need to realize how serious an HPV infection has to be. If you combine the other 4 diseases that we are protecting, HPV has the likelihood of killing you 20 times more.
No kidding.
And even if you don't die, well, I hope not, you can get very sick from these diseases. I tell you, if you get whooping cough, you can be coughing for 4 to 6 weeks, no stop.
Wow.
You know, and in infants it can be extremely serious.
Wow. Okay. So in terms of the frequency of getting these, you know, I know the Technus has recommended, you know, once every 10 years, but is this like an annual boost that we need? 5 years? What sort of timeline?
The Tdap is every 10 years.
Every 10 years.
That is the recommendation.
Okay.
The meningococcus, you give a dose today, you have to get a booster in 3 to 5 years.
Okay.
And the HPV is a series of 3 doses.
3 doses.
One today, the second one 2 months from the first dose, and the third one 6 months from the first dose.
And then that HPV booster is done? Do you need to?
With the 3 series, you are done.
After the 3 series.
If we compare with another vaccine that is given in the same way, that is hepatitis B, you get immunity for at least 30 years.
Wow. Okay.
You know? That is one of the arguments that people say that why not to give the vaccine, that the immunity is not safe or long enough, and that is not true.
Okay.
I mean, it's very effective against the vaccines that can lead to have a cancer.
Yeah.
You know, and like I said, is HPV is the most common transmitted, sexually transmitted disease.
Really?
And the most fatal after HIV.
Wow. That is scary stuff. Well, Doctor, thank you for coming in. Thank you for breaking this down, folks. And for a full recap on what Dr. Zanghellini has to say, head over to KASA.com, click on the KASA blog, check up on your immunization and your vaccination records, folks. Doctor, thank you so much.
Thank you, sir.
We'll be right back, folks.